Residency is a time that is challenging. You are pushed to learn how to be a doctor. You're pushed to do things that you haven't done before or you might not feel entirely comfortable with. But our job as your residency leaders are to help push you a little bit out of your comfort zone to really make you into the best doctor you can possibly be. We do that through a variety of ways. We have some individualized learning pathways for you to develop your own interests. So if you are really interested in biodesign and innovation, we have a pathway for that. If you're really interested in medical education, we have a medical education pathway, a hospitalist pathway, a global health pathway, and an intensified research pathway. And these are all designed to help you to be able to investigate the things that are really interesting to you. It's also through our mentored research process, where we will help pair you with people to help you get either the QI or the research done that you're looking to do. It is helping you in your fellowship goals or your career goals, really helping to match you to the next step in your career. But all of that really is predicated on this belief that it is our job to make you better, to make you into the doctor that you really want to be, and to really help you along the way. We have our firm system, which really helps to give you leadership wherever you are, whether that's on the inpatient service or in clinic. Your firm leaders are there with you. We also structure your years in a way that we think is kind of most beneficial to you. And so your years go from your intern year, which is pretty standard, where you have about 5 months of inpatient, really to help cement the medicine that you are learning, to really be that primary caregiver, and to really allow yourself to move into that role as physician. And then as the years progress during your year 2 and 3, those years get individualized depending on your goals and what you would like to do. I think one of the other things that makes Montefiore special and makes this residency special is we believe in helping you to grow, but we help you to grow by giving you the space to really make the initial medical decisions. And so some of the ways that this happens, our admitting structure, you and your resident will help go through the admission. You will then, put in orders, get the tests, do the things that you think are appropriate for that patient, present the patient in the morning, and in that really learn from a different perspective how that would have gone and potentially getting feedback on the decisions that you make. In clinic, we encourage you to be autonomous. While you will precept every case, you will have supervision. Really, you are driving that care. Another way in which we show that autonomy is really important to us is our code teams. And so throughout the institution, all the codes are led by our 2nd and 3rd year residents, and then also staffed with our interns, so that really you can take care of that spectrum of patients. You can take care of them in clinic, and you can also take care of them when they're critically ill. One of the things that I am proudest of as my residents leave is that they are really capable of anything. I hear back from fellowship directors, I hear back from employers, and unanimously they say that Montefiore graduates really can handle anything, from any clinical situation to anything research oriented to anything within a hospital system. With this training, you can really go and do anything. And our residents have been profoundly successful. Generally speaking, they get one of their top 3 fellowship choices. They usually get their top choice as they move into their career. And I think part of that is really the training that you have gotten here to learn how to care for people, because that, at the end of the day, is always valued and always appreciated, just as we value it here.